Alright, we are going to be measuring external rotation with the goni. Have your patient elbow propped up on a towel. Make sure their arm is abducted to 90 degrees, and your fulcrum goes on the olecranon process of the ulna. Your proximal arm goes on the styloid process of the ulna, and then your distal or stationary arm is perpendicular to the floor. And you're not moving them at all. This is just as far as they can go. Go ahead and go back. Alrighty, she is about at 86. Normal range is 90. What we're going to do is passive range of motion for external rotation. Again, have your patient a towel underneath their arm. If they can't have their arm abducted to 90, no worries at all, just as long as it's abducted a little bit. Stabilize here at the humeral head, and then kind of grab the wrist right here. Elbow bent to 90 degrees, just kind of going back. Just kind of back and forth like that. And biggest thing about passive range of motion is they're not doing any of the work, is they're just staying completely still and relaxed. Next thing we're going to do is an active assisted range of motion using a dowel rod, or you can use a cane. Have your patient again, elbow underneath the towel, kind of abducted 15-20 degrees. And it's kind of almost like a seatbelt motion is how we call it. And they have their arm right here, their elbow flexed, and all they're doing just pushing out like that. A couple of big things is you want to make sure your patient isn't going across and straightening out their elbow. Keep that elbow nice and bent. And they should feel a good stretch right here in that anterior part.
Yeah, I felt better. I just hovered it.
Just like that.
It's awkward. You can't get it.
They can do this for a set 20 or 2 minutes. Next is active range of motion for external rotation. Biggest thing is they're going through their available range of motion on their own. I'm doing side lying ER. Have your patient side lying position, towel underneath their arm, nice 90 degree elbow bent, and they're just kind of rotating it. They could go to neutral right here, come back down. Facing again, make sure they're not like straightening out their elbow or rotating their back too far. Just keeping it nice and neutral, like that. And you can do 20 reps. Next thing we're going to do is an exercise you can do in the acute phase of injury for shoulder external rotation. Really great thing, you can use this for patients. They can use that at home. You can grab a pillowcase and slip your arms in between it like this, and you're just kind of pushing out. Biggest thing, make sure your arms aren't chicken winging out, keep them nice and tucked in, and you're not putting so much tension on it that you're trying to break the pillowcase. Another big thing is make sure they're sitting up nice and tall and not kind of hunched over, like that. A good thing you can do with this, since it's an isometric move, you can hold it for about 10 seconds, relax, do that 10 times. Good job, Bailey. An exercise you can do in the subacute phase of injury for external rotation is external rotation using a TheraBand. Have your patient come out to neutral, again have that towel underneath their arm to have like 15-20 degrees of abduction. Then what you can do, nice tall posture, they're just rotating out, coming back to neutral like this. Biggest thing, not straightening out their elbow like that, not twisting the whole body, but everything nice and still. Bailey, go ahead and try it. Make sure to come out with a little bit of tension on the band. Not too neutral, and then stop it. Go ahead and go to neutral. Yep. Perfect. Just like that, you can do 20 reps of those, or however many. Right. Next, we're going to go through the different PNF stages, which is proprioceptive neuromuscular facilitation. All this does is it takes your motion through all the different planes, and it's a very good functional task for your patients to do to get back to work or get back to sport or get back to their life. So D1 extension, start up here, palm facing to the back, going all the way down, and then your palm ends up facing the back of the room. So you have extension, internal rotation, and abduction. And you can do about 10 reps of this, and then we'll switch for the other ways. Go ahead and go for it. A couple of big things. Again, watch for shoulder shrugging. Make it nice and slow and controlled. Definitely not just moving their arm. And really focusing on rotating, getting that supination, internal rotation, going through all those movements. Next, we're going to do D1 flexion. So you start with your resistance down at the bottom, and you're doing that same motion, except now you have the resistance coming up. And this encompasses shoulder flexion, adduction, and then external rotation. So again, watching that palm face the back of the room, and then you go up, and then you rotate it. Again, keeping it nice and slow and controlled, and going through those 3 planes of motion. Then you can do about 10 reps, go in this direction. Good job. Next, we're going to go through the D2 pattern. D2 flexion, start with your resistance down at the bottom, thumb in your left hip pocket or palm facing away. Then you're just going to rotate across your body like that. Again, nice and slow, making sure you're going through all the motion. Bailey, you want to go through it? Good job. Last thing we're going through is the D2 extension, which is extension, abduction, adduction, adduction, and then internal rotation. Go ahead, get some tension on your band, palm facing forward, and then you're going to go down, rotate until that thumb is in your pocket. Go ahead and rotate back up. Again, keeping tension on the band, going nice and slow, making sure you're not going too fast, and make sure you're really focusing on each movement that you're going through. Go ahead, Bailey. Your patient can do 10 reps of these. Like I said, PNF is really good for kind of that end of treatment, going back into work, going back into sport sort of training.
Did you turn it off?
No, I'll go one more. Do one more.